There's a tremendous urgency to seek attention. I think whenever a woman has noticed unexplained redness, tenderness, swelling in the breast, I think she should seek attention immediately. Inflammatory breast cancer is a very aggressive form of breast cancer that may present itself over days or weeks to a patient. It presents itself as redness, tenderness, visual signs, swelling of the breast. Sometimes the nipple is very swollen and tender. And the patient will have perhaps had a normal examination 2 or 3 months earlier, when a normal mammogram even a month earlier, only to find changes in the breast that are this dramatic. So it can present itself very quickly. And of course, it's confirmed by doing a biopsy that shows cancer in the breast. So one thing that's different about inflammatory breast cancer is that more often than other types, it may present as advanced disease. So women typically, when they present with a new breast cancer, don't have any signs of cancer outside of the breast or the lymph nodes. With inflammatory breast cancer, as many as 30% of patients already have disease that may have spread to other parts of the body. That's one big difference. And a second difference is that surgery is not the primary treatment of this cancer. It almost always requires a period of medication, chemotherapy, prior to any potential surgery, and always requires radiation, whereas that's not always necessary for all women with breast cancer. One of the reasons a patient should consider Tufts as a center of excellence for inflammatory breast cancer is that we try to include all aspects of care under one roof. So a patient who might notice a symptom that needs immediate attention and make an appointment within 2 or 3 days to see us would be offered the opportunity to see surgeon, medical oncologist, radiation oncologist, social worker, nurse, and pathology services are immediately available, as are imaging and radiology services. I'm proud to say that goes back to the 1970s, when the concept of multidisciplinary breast cancer care was really born here and at 2 or 3 other centers in the United States. But one of the most favorite times is to see a patient coming back 5 or 10 or 15 years after treatment for a disorder like inflammatory breast cancer, and we're starting to talk about grandchildren, and we're starting to talk about all of the other things that make life worth living. And the patients are remarkably strong, and they know they can get through it. They just want to know if they can have a little bit of hope that what they're doing is going to be effective. So that's a very rewarding part of the day, too, just trying to offer a little bit of hope to patients to get them through what is oftentimes a very difficult period in their life.